If you've lived your whole life, middle class or higher, and healthy, you've probably never had to deal with the fear of whether to skip a few meals and go to the hospital or to see if an injury just works itself out. This is not the case for those in poverty. Because for someone in poverty, having a common condition like diabetes will make you pay for extremely expensive medicine out of pocket. This expensive medicine will make you work until exhaustion just to pay for it. This is likely to land you in the hospital, which will help you, but in turn, you will have to pay very expensive medical bills on top of your already expensive medicine. This cycle of poverty repeats forever because the person in poverty cannot get the help that they need, but they still have bills to pay. This is the exact reason why we need universal health care. Universal health care has vast economic and social benefits that make it worth fighting for. Personal taxes are the first thing people think about and maybe ask about when somebody else mentions universal health care for America. People fear that if universal health care is implemented, that the people who need it the least will be paying the most in order to implement it. And while this is true, there's so much more that needs to be considered than just taxes when talking about universal health care. Because while you may pay a little more in taxes, you will find that you pay a lot less on medical accidents, appointments, and insurance. Let's check this in take-home pay in a country with universal health care, Germany versus America, where we do not. Germans take home an average of $3,248.64. In America, we take home an average of $4,662.62. Considering the cost of living in both countries, in America, it being $1,162.04, and in Germany, it being $1,027.09, you find that Germans take home an average of $2,220.74, and Americans take home an average of $3,500.22. This seems problematic. If universal healthcare is so good, then shouldn't Germans' take-home pay be so much more than Americans? No, because not only does Germany have universal healthcare, but they also have maternity and paternity leave, proper breaks within working hours, and sick days that don't take away your paid time off. This means that a person in Germany is able to work a living wage without overly stressing themselves out. And some of the same companies that function in the US still work under the German system. Some of these include Amazon, BMW, and Adidas. This is important because for those of us in middle class or higher, we do not have to worry about this. But for those in poverty, paying for anything is a struggle, but especially medical insurance. If medical insurance isn't free, then somebody isn't going to be able to pay for it. So who do we believe doesn't deserve health care? This very specific question is important to be asked when talking about who is affected by not having free health care. Families USA, a nonprofit organization, did a study and found that between 2005 and 2010, those without universal health care, specifically in America, die in a range of 20,350 and 26,100. That is a lot of people dying for seemingly no reason. And the American government has seen this and knows about it and has decided to sit idly by while the people they are supposed to be taking care of die. And this is not a thought of political sides in America, but is instead an observation of the system as a whole. Martin Luther King even commented on it in a speech directly related to the Medical Committee of Health, saying that of all the forms of inequality, injustice in health is the most shocking and inhumane. If people die for no reason, then that means our system is broken. And Georgetown University specifically posted a research notice about how having insurance alone impacts children in poverty, finding that Medicaid is estimated to reduce child poverty by 5.3 percentage points. If insurance can do that much alone, imagine how much more could happen with a free universal healthcare system. Overall, this probably doesn't affect that many people in this room or even in this school. But I want to remind you that as you go about your daily life, even though the economic and social factors don't matter to you that much, to decide to take notice of the person in the street in the shivering cold with only a blanket. Decide that the person who can't pay their pharmaceutical company is worth so much more than their paycheck. Decide that if you or a loved one were ever to enter this unfortunate situation, you would want someone to care. Because we may not matter in the grand scheme of the universe, but maybe we do. And I think that's worth holding on to, no matter how many times you may have been told otherwise. Thank you.